Movement disorders. Part 1. What qualifies as a movement disorder? There are those movements that occur late in the day or when transitioning from wake to sleep. There are movement disorders that disrupt sleep. Both types can cause sleep disruptions. You may be familiar with the tossing and turning that occurs when you're unable to fall asleep at night. But for millions of Americans who suffer from sleep movement disorders, it's the uncontrollable twitching once they climb into bed that prevents them from sleeping in the first place. These common sleep movement disorders can wreak havoc on your nightly slumber. Let's learn what you can do about it. Part 2. Types of movement disorders. The following are the different types of movement disorders. Restless leg syndrome. Restless leg syndrome. Approximately 10% of adults in the United States suffer from restless leg syndrome or RLS, a condition in which a person has overwhelming, often unpleasant urges to move the legs while relaxing. Not surprisingly, this can result in poor sleep quality. While the exact root cause of RLS isn't known, the disorder often runs in families. It affects both men and women and often worsens as people get older. The good news is that RLS can be treated with lifestyle modifications such as limiting caffeine and alcohol intake, exercising regularly, and adjusting medication intake, since some drugs can make restless leg syndrome worse. About 60% of the people with restless leg syndrome have periodic limb movement of sleep, or PLMS. Restless leg syndrome, also called Wills-Ekbom disease, causes unpleasant or uncomfortable sensation in the legs and is irresistible urge to move them. Symptoms commonly occur in the late afternoon or evening hours and are often most severe at night when a person is resting, such as sitting or lying in bed. They also may occur when someone is inactive and sitting for an extended period of time. Since symptoms can increase in severity during the night, it could become difficult to fall asleep or return to sleep after waking. Moving the legs or walking typically relieves the discomfort, but the sensations often recur once the movements stop. Restless leg syndrome is classified as a sleep disorder since the symptoms are triggered by resting and attempting to sleep. And as a movement disorder, since people are forced to move their legs in order to relieve symptoms, it is, however, best characterized as a neurological sensory disorder with symptoms that are produced from the brain itself. Restless leg syndrome is one of several disorders that can cause exhaustion and daytime sleepiness, which can strongly affect mood, concentration, job and school performance, as well as personal relationships. Many people with RLS report that they often are unable to concentrate, have impaired memory, or fail to accomplish daily tasks. Unrelated, moderate to severe RLS can lead to about 20% decrease in work productivity and can contribute to depression and anxiety. It can also make traveling difficult. It is estimated that up to 7 to 10% of the U.S. population may have restless leg syndrome. Restless leg syndrome occurs in both men and women, although women are more likely to have it than men. It may begin at any age. Many individuals who are severely affected are middle-aged or older, and the symptoms typically become more frequent and last longer with age. More than 80% of the people with restless leg syndrome also experience periodic limb movement of sleep, PLMS. PLMS is characterized by involuntary leg and sometimes arm twitching or jerking movements during sleep that typically occur every 15 to 40 seconds, sometimes throughout the night. Although many individuals with RLS also develop PLMS, most people with PLMS do not experience RLS. In most cases, the cause of restless leg syndrome is unknown. However, Restless leg syndrome has a genetic component that can be found in families where the onset of symptoms is before age 40. Specific gene variants have also been associated with restless leg syndrome. Evidence indicates that low levels of iron in the brain also may be responsible for restless leg syndrome. Considerable evidence also suggests that restless leg syndrome is related to the dysfunction in one of the sections of the brain that control movement, called the basal ganglia, that uses the brain chemical dopamine. Dopamine is needed to produce smooth, purposeful muscle activity and movement. Disruption of these pathways frequently results in involuntary movements. Individuals with Parkinson's disease, another disorder of the basal ganglia's dopamine pathways, have increased chance of developing restless leg syndrome. Sleep deprivation and other conditions like sleep apnea may also aggravate or trigger symptoms in some people. Reducing or completely eliminating these factors may relieve symptoms. Fortunately, most cases of restless leg syndrome can be treated with non-drug therapies and, if necessary, medications. Restless leg syndrome also appears to be related to or accompany the following factors or underlying conditions, including diabetes, joint displacement or bone damage, kidney disease or dialysis, medications such as SSRIs and anti-nausea drugs, antipsychotic drugs, antidepressants that increase serotonin, and some cold and allergy medications that contain older antihistamines, low ferritin levels, pregnancy, and neuropathy. Part 4, symptoms. Symptoms can be described as creepy, crawly, itchy, a need to move, or bugs under the skin. It is worse in early evening to night, around 5 to 6 p.m. It will get progressively worse and will depend on the age it starts. It can spread to other limbs or other times of the day. Part 5, treatment. Iron supplements if person has low ferritin levels. For individuals with low or low normal blood tests called ferritin and transferritin saturation, a trial of iron supplements is recommended as the first treatment. Iron supplements are available over the counter. A common side effect is upset stomach, which may improve with the use of different types of iron supplements. Because iron is not well absorbed in the body by the gut, it may cause constipation that can be treated with a stool softener, such as polyethylene glycol. In some people, iron supplements do not improve a person's iron level. Others may require iron given through an IV line in order to boost the iron levels and relieve symptoms. Some doctors use levodopa, however, the side effects can be worse than the condition. The drug increases dopamine effect. They have been shown to reduce symptoms of restless leg syndrome when they are taken at nighttime. The FDA has approved roperidol, The FDA has approved several drugs to treat moderate to severe restless leg syndrome. These drugs are generally well tolerated but can cause nausea, dizziness, and/or short-term side effects. Although dopamine-related medications are effective in managing restless leg syndrome, long-term use can lead to worsening of the symptoms in many. With chronic use, a person may begin to experience symptoms earlier in the evening or even earlier until the symptoms are present around the clock. Over time, the initial evening or bedtime dose can become less effective. The symptoms at night become more intense and symptoms could begin to affect the arms or trunk. Fortunately, this apparent progression can be reversed by removing the person from all dopamine-related medications. Other important adverse effect of dopamine medications that occur in some people is the development of impulsive or obsessive behaviors, such as obsessive gambling or shopping. Should they occur, these behaviors can be improved or by reversing or stopping the medication. Other options. For some, compression socks or air compression boots may appear to help to short circuit some of the overstimulated nerve cells. Taking a walk and massaging sometimes also helps. Certain lifestyle changes and activities may provide some relief if you have mild to moderate symptoms of restless leg syndrome. These include avoiding or decreasing the use of alcohol and tobacco, changing or maintaining a regular sleep pattern, a program of moderate exercise, taking a warm bath, or using a heating pad or ice pack. There are new medical devices that have been cleared by the U.S. Food and Drug Administration, the FDA, including a foot wrap that puts pressure underneath the foot and another that is a pad that delivers vibration to the back of the legs. Aerobic and leg stretching exercises of moderate intensity may also provide some relief from mild symptoms. Part 6. Wives' Tales. It's not all in your head. There are old wives' tales about everything. Sleep has its own set of folk cures that don't work and border on ridiculous. Ivory soap is not a cure. Warm milk is more a psychological than physical solution. It is not in your head. Alcohol is not a sleep remedy. Part 7. Other leg movements. Periodic limb movement disorder, similar to restless leg syndrome, refers to the uncontrollable repetitive movements that occur in the lower limbs every 20 to 40 seconds during sleep. These can include brief muscle twitches, jerking movements, and upward flexing of the feet. Episodes can last from a few minutes to several hours. Because these frequent movements may cause awakenings or mini arousals during the night, they can contribute to chronic insomnia and daytime fatigue. The underlying cause of periodic limb movement disorder isn't known, but it often accompanies restless leg syndrome. Alternating leg muscle activity shorts, bursts of activity that alternates between legs is usually seen at the beginning of the night. Foot tremors or foot tapping can be a problem. Excessive fragmentary myoclonus leg twitches that disrupt sleep. These are shorter than periodic limb movement syndrome and usually happen during the transition from wake to sleep. Leg cramps or Charlie horses can appear. If this does happen, look at the electrolyte levels and circulation issues. Part 8. Rhythmic movement disorder. Rhythmic movement disorders, including body rocking, head rolling, and head banging, are parasomnias that occur largely during sleep-wake transition and are characterized by repetitive, stereotypic movements involving the large muscle groups. They are much more common in the first year of life and generally disappear by age 4, but in rare cases they persist into adulthood. Although occasionally associated with developmental delay, most occur in normal children and do not result in physical injury to the child. Treatment is generally parental reassurance and, if appropriate, judicious patting on the sleeping surface. Rhythmic movement disorder is usually seen in toddlers to early adolescence. It is a rhythmic moving that occurs when a person starts to fall asleep and is a large movement such as rocking, head or leg banging, or head rolling. Children usually grow out of it. They usually are unaware they are doing it and will not remember doing it when waking. Part 9. Bruxism. If you've ever woken up with a sore jaw, you may have experienced sleep bruxism, a condition which involves clenching or grinding your teeth during sleep. An estimated 8% of adults have sleep bruxism. If it happens occasionally, it may not be harmful, but regular sleep bruxism can lead to dental damage, facial pain, and sleep disturbances. The cause isn't fully understood, but some research suggests it is linked with anxiety, the use of certain medications, and sleep apnea. Reducing stress can help. For severe or ongoing bruxism, your dentist may recommend that you wear an oral appliance such as a bite guard while you sleep. Bruxism is the grinding or clenching of teeth during sleep. It can be bad enough to cause arousals from sleep, or it can wake bed partner. It can also cause jaw or teeth pain, headaches, or TMJ pain. The treatment are relaxation techniques and an oral guard. You are now ready for the next module.